This is Dental Topics Discussion. Welcome to the Clinical Case Discussion Part 1. Case 1. 30 years old female patient complaining of unspecified type of pain on the right lower jaw and the right tonsillar area. She said she has been feeling this pain for the past 8 months following extraction of 48. She gets relief by taking anti-pain, but it gets back after 3 to 4 hours. No medical history. On clinical examination, she has good oral hygiene, but missed 48, and there is no open or infected extracted socket of 48. Rather, it healed well and the ridge is resorbed. No salivary gland mass or tenderness, normal TMG, no cavities. But palpation on the ridge of 48 on the lingual wall is highly positive. No sign of infection. The patient also complains about pain on the side while swallowing food. On OPG we see no abnormality or pathological lesions, no remaining root of 48. The socket is completely closed. What will be the differential diagnosis and how do you treat her? So the answer is nerve injury, axonotemesis, 3rd degree. And the treatment is going to be vitamins, neurobin, vitamin B complex drugs. Discussion on the topic. As you know, impacted mandibular 3rd molar teeth are in close proximity to the lingual, inferior alveolar, mylohyoid, and buccal nerves. During surgical removal, each of these nerves are at risk of damage, but the troublesome complications result from inferior alveolar or lingual nerve injuries. What is nerve injury? Nerve injury is most serious complication that may occur during oral surgical procedures, especially when we are damaging large nerve branches such as during dental injections, root canal treatment, insertion of dental implants, extraction of teeth, and other surgical treatments. Signs and symptoms of nerve injury: numbness or pain in the chin, lip gums and tongue, tingling or electric shock sensation, impaired speech, loss of taste, abnormal chewing, biting of tongue and lips, burning sensation, and paralysis like Bell's palsy. According to Sutton, nerve injury is classified into 3 groups: neuroparaxia, axonotemesis, and neurotemesis. Neuroparaxia represents a failure of nerve conduction, usually irreversible, that is caused by metabolic or microstructural abnormalities without disruption of the axon. It represents an injury to the myelin. Axonotemesis represents an injury to the myelin and the axon with the preservation of the nerve supportive connective tissue, which is endoneurium, which results in axon degeneration. Neurotemesis is the partial or complete transection of the nerve that causes discontinuity of the myelin and the axon proximally and distally, and that leads to distal Wallerian degeneration of the nerve. Sunderland improved the classification of nerve injury of Sutton. He classified it into 5 groups from grade 1 up to grade 5, as you can see on the table. Please subscribe for more videos like this.